A new study suggests the number of Alzheimer's patients could triple by 2050. Dr. Murali Doraiswamy is a professor of psychiatry and behavioral sciences at Duke University. Welcome.
Thank you.
So why are these numbers, these alarming numbers, going up?
Well, it's what we call the silver tsunami. There are three reasons.
Okay.
One is the graying of America, the big rise in people 65 plus. The numbers are expected to double. So as we get better at treating heart disease, cancer, as we live longer, the consequences, we may be at risk for Alzheimer's.
Is there anything we can do to prevent it?
There's no magic bullet right now, but there are several trials of experimental treatments underway. But there are a lot of things that we can do to try to reduce our risk. For example, the single biggest risk for Alzheimer's, I think, is strokes and vascular risk factors. So being heart healthy, exercising, trying to eat sort of a diet that's not too fatty, low saturated fats, and also keeping yourself mentally active and socially active. All of these are things that each one of us can do.
You talk about this silver tsunami. So
Yes.
How is our healthcare system going to be able to handle these cases?
It's pretty scary. We are broke, and we're going to go from broke to being really broke. As the number of cases triples by 2050, it's expected to add about $2 trillion to our healthcare budget. The number of family caregivers is going to go from 15 million people right now to maybe about 50 million.
Oh my
So
goodness.
it's very scary.
When you talk about being mentally active, what exactly does that mean? The other day I forgot the name of a singer who I know very, very well, and I honestly could not remember it.
Right.
When should I be concerned?
So we have a saying in our field, if you cannot remember what you forgot, that's when you need to be concerned. So the first question I would ask you is, did the information come back to you at a later point, an hour later?
An hour later, yes.
Then there's no problem at all, and
okay.
that's how we differentiate Alzheimer's from just benign forgetfulness.
Okay.
Yeah, we have benign forgetfulness all the time.
This morning.
This morning I had benign
It's
forgetfulness. on something.
multitasking forgetfulness. And another important point to make is that the reason for catching Alzheimer's early is that there are many potential causes that could be reversible, such as depression, thyroid problems, vitamin deficiencies, etc. So it's really very important for people to know that. Otherwise, they're in denial oftentimes, and they don't try to seek attention.
And doctor, one of the things that in talking to people is that one of the most important things I've heard in preventing Alzheimer's is physical activity.
Correct.
Keeping the blood moving so that your brain cells are getting a lot of blood and then you don't develop that gray material. That's obviously a layman's explanation, but is that right? I mean, physical activity
Yes. Aerobic exercise is amazing for the brain. For starters, it cuts down your risk for stroke, improves blood supply to the brain, and there is evidence that a walk a day can keep Alzheimer's away. It's not 100%. There is a big trial underway to test it, but I strongly recommend it for everyone.
Oh, so if
good.
you walk a day and eat an apple, we'd be in good shape.
Yeah.
You wouldn't need me.
No, we need you, Dr. Doraiswamy. Thank you for coming. Thank
Pleasure.
you so much.